going to start our discussion on deltoid muscle, its origin, insertion, and the structures which are inside it, right? So first we'll start with the origin of deltoid muscle. So if you see the deltoid muscle, it is divided into three parts. So that is the anterior unipinnate part, the middle multipinnate part, and the posterior unipinnate part. So three parts: anterior unipinnate, middle multipinnate, posterior unipinnate. So these three parts are in turn having three origins, right? So mainly the origin of this anterior unipinnate part is from the lateral 1/3 of clavicle. So this is a clavicle. So this is its lateral 1/3. So from the lateral 1/3 of clavicle, it's get the anterior border insertion. Okay. Next, coming to the middle part is multipinnate, right? So that middle part will get its origin from the lateral border of acromion. This is the acromion process, this is the medial side, this is the lateral border. So the lateral border of acromion, where its four septa of origin. So four septa of origin come from the lateral border of acromion. The next, coming to the posterior part, posterior unipinnate part gets its origin from the lower lip of crest of spine of scapula. So if we say this is the lower lip of crest of spine of scapula. So this is the origin. So remember, deltoid muscle is divided into three parts: anterior unipinnate, middle multipinnate, and posterior unipinnate. The anterior unipinnate, it's getting its origin from the lateral 1/3 of clavicle, whereas the middle multipinnate, it's getting its origin from the acromion process, lateral border of acromion process, whereas the posterior unipinnate, it's getting its origin from the crest of lower lip of spine of scapula. That's it. So very simple. So three parts of deltoid having three parts of origin. Now let us see its insertion. So now it has origin, right? So where it is getting inserted, you can see this side. So here it's getting its insertion. So insertion into the deltoid tuberosity of humerus, where three septa of insertion are attached. So all these three parts, three septa, are inserted into the deltoid tuberosity. In the name itself, you can see the muscle we are talking now is deltoid. So it is having a tuberosity called deltoid tuberosity, which is present on the humerus, right? So there it will go and attach. The deltoid tuberosity is a V-shaped structure. So there it will go and attach. So what is the nerve supply to this muscle? The nerve supply is mainly the axillary nerve. So the axillary nerve root value is in turn C5 and C6. If you see my brachial plexus video, you will understand what are the root values of different nerves. So the axillary nerve root value is C5 and C6, which supplies this deltoid muscle. So just now which we discussed that the acromial part of deltoid is actually an example of multipinnate muscle. Many fibers arise from the four septa of origin that are attached above to the acromion. So the fibers converge onto three septa of insertion, which are attached to the deltoid tuberosity. So actually many fibers originate from this acromion process, and all this finally converge and they form as a one fiber, single fiber, and insert to the deltoid tuberosity of the humerus, right? So a multipinnate arrangement allows a large number of muscle fibers to be packed into a relatively small volume. So as the strength of the contraction of muscle is proportional to the number of muscle fibers, right? So what they are saying, the strength of the muscle is directly proportional to the number of muscle fibers. That is, if there are more number of muscle fibers, then more strength to the muscle. So deltoid is having many muscle fibers, so it's more strength, right? And it's a multipinnate muscle, is much stronger than other muscles having same volume. So as I said, the anterior part is unipinnate, posterior part is unipinnate, the middle part is multipinnate, right? So middle part of the deltoid is very much stronger when compared with this posterior part and anterior part. Okay. So now we will see the action. So we have understood its origin, insertion. Now let us go to action. What action it does? It does the acromial fibers are powerful abductor. What is abduction? For example, if you see in this diagram, this is abduction, means going away from the body. So adduction means towards the body, right? Abduction means away from the body. So this action of acromial fibers is powerful abductor of arm at the shoulder joint from beginning at 90 degrees. And the anterior fibers are mainly flexors and medial rotators of arm. So their anterior fibers are unipinnate, they are flexors, medial rotators, whereas posterior fibers are extensors and lateral rotators of the arm, right? What they are saying, anterior fibers are flexors and medial rotators. Posterior fibers are extensors and lateral rotators. Whereas this middle multipennate part is abductors, powerful abductors of the shoulder joint of the arm. Right. So now we will see what are the structures inside this deltoid muscle. So in this diagram you can clearly make out the structures, especially first we will talk about bones. What are the bones inside the deltoid muscle? So if you remove the deltoid muscle and see, then the first bone you find is humerus. The upper end of humerus is mainly seen, and also you will see the coracoid process. This is the coracoid process, right? So the coracoid process and the upper end of humerus are seen if you remove the deltoid, because you can imagine this deltoid will be from here and it is inserted till here, right? So now we have removed the deltoid, you can see coracoid process, you can see the upper end of humerus, right? Next, coming to the muscles. Actually muscles are divided into insertions and origins. So mainly there are insertions of pectoralis minor on coracoid process. So this is a coracoid process. Actually here the pectoralis minor muscle will come and attach. This is the insertion, and also you will see the supraspinatus and the infraspinatus muscles, and also you will see the teres minor muscle, right, on the greater tubercle of humerus. So you can see it will attach to the greater tubercle of humerus, and you will see the subscapularis on the lesser tubercle of humerus. Lesser tubercle will be that side, right? So on the lesser tubercle of humerus you will see the teres you will see the subscapularis, and pectoralis major, teres major, latissimus dorsi. So you can see here latissimus dorsi, teres major, pectoralis major. So all these muscles are seen on the intertubercular sulcus of humerus. They will be seen in the intertubercular sulcus of the humerus. So once again here you can see what are the insertions of muscles. Mainly pectoralis minor is seen on coracoid process. Supraspinatus, infraspinatus, teres minor are seen on greater tubercle of humerus. Subscapularis on lesser tubercle of humerus. Pectoralis major, teres major, latissimus dorsi on the intertubercular sulcus of humerus. Now we will see origin. There are different origins of muscle like coracobrachialis. I will show you in diagram. So you can see here the coracobrachialis and short head of biceps brachii. Even the long head of biceps brachii will be seen, and right, long head of biceps brachii from supraglena tubercle. Coracobrachialis, short head of biceps brachii from coracoid process, and you will see long head of triceps brachii from infraglena tubercle. Lateral head of triceps brachii from upper end of humerus. So these are all the structures which are inside the deltoid. So coming to the vessels, if you remove the deltoid, what vessels you can see? Anterior circumflex and posterior circumflex humeral. You know this anterior circumflex, posterior circumflex humerus are around the surgical neck. They wind around the surgical neck of the humerus. And the nerve you see is axillary nerve inside the deltoid, and the joints and ligaments are musculotendinous cuff of shoulder. There is nothing but the rotator cuff, we'll discuss about it, and also you'll see the coracoacromial ligament. Next, coming to the bursa, you will see all bursa around the shoulder joint, including the subacromial and also subdeltoid bursa. You can see here this is called as subacromial bursa. This is subacromial bursa, and you will also see the subdeltoid bursa around the deltoid muscle. So let us understand the trick to remember the muscles. Of course, bones it's easy, you will see the humerus. You can imagine if you remove the deltoid, first you will see humerus upper end. You can also see coracoid process, it's well understood, no need to remember that. But the muscles of insertion also very nice trick. First remember majors and minors. You have pectoralis major, pectoralis minor. You have teres major, you have teres minor, and also you have the latissimus dorsi. Done. And next you also have the scapular muscles like supraspinatus, infraspinatus, subscapularis. Done. See, everything is done. Pectoralis minor, pectoralis major, teres major, teres minor, and supraspinatus, infraspinatus, and also you will see the subscapularis. Done. Very easy to remember the insertions. Now let us understand the trick to understand the origin. So to remember the origin, remember first the coracobrachialis. Okay. Next you remember the biceps brachii. It's short head and also long head. Okay. Short head of biceps brachii, long head of biceps brachii, coracobrachialis. Next remember the long head of triceps brachii. Next remember the lateral head of triceps brachii. Very simple to remember. What are the origin of muscles inside the deltoid? Coracobrachialis, short head of biceps brachii, long head of biceps brachii, long head of triceps brachii, lateral head of triceps brachii. Very simple. So to remember vessels also it's very simple, because as we said, under the deltoid you see the humerus bone. So of course, covering the humerus bone, what vessels you have? Anterior and posterior circumflex humeral arteries, right? And the nerve is of course axillary artery. You can very easily remember, axillary artery only supplies the deltoid, so it will be inside that. And joints and ligaments also easy. You'll see rotator cuff inside because there is a shoulder joint, and also you'll see the coracoacromial ligament because you see even the coracoid process inside the deltoid. And bursa is nothing but of course the shoulder joint bursa and subacromial subdeltoid bursa. So by this we have completed the deltoid, everything about deltoid. Next we'll see the other muscles of the scapular region.